السلام عليكم جميعا. السلام عليكم ورحمة الله. Welcome to today's session of the Ramadan Pioneer Series. It's an initiative by the Dubai Future Academy. It's the capacity building arm of the Dubai Future Foundation. I'm very happy today to welcome the speakers from the Dubai government with us. We're going to start with Dr. Mohammad Redha from the Dubai Health Authority. And we have Dr. Naseem Mohammad from the Dubai Municipality and Brigadier Khalid Alrazooqi from Dubai Police. Thank you all for coming. And my name is Khalifa AlQama. I am with the Dubai Future Foundation working in the labs department. So, gentlemen, very quick question and a broad question that I think is the topic of today's discussion, which is how is the government in general applying technology, medical or technical or otherwise, in combating the current situation that we are facing today. And with that, I'd love to start with Dr. Mohammed from the Health Authority to really give us an idea.
Shukran, Khalifa. Thank you so much. And thank you to Dubai Future Academy and Dubai Future Foundation for organizing such a wonderful platform, the Health Pioneers platform, which I personally am going to miss after Ramadan. We got into the habit of joining every day at 4:30. So this is going to be a habit that I will miss dearly. I couldn't be happier to be joined by His Excellency Mr. Khalid Alrazooqi, Brigadier Khalid Alrazooqi, and Dr. Naseem Mohammad, Director of Public Health from Dubai Municipality. Both are colleagues and both have been maybe frontliners behind the scenes with government of Dubai in fighting COVID-19. Allow me, Khalifa and Your Excellencies, to share my screen. I have prepared a few slides which will depict صراحة, a little bit of the efforts that have been done in terms of fighting COVID-19 from a Dubai Health Authority perspective. I hope I give you a good overview on that. So when asked to speak about the role of technology in the pandemic and the fight against COVID-19, allow me also to explain a little bit of how we work in government. So yes, I represent Dubai Health Authority. However, in this pandemic, we work very closely with our brothers and sisters from United Arab Emirates, Ministry of Health, Mohammad, and Dubai Department of Health in Abu Dhabi as well, and NCEMA, which is the National Emergency Crisis and Disasters Management Authority. So all four of us form a unity, honestly, when it comes to healthcare issues and working together. I cannot stress the importance of this because collaboration, coordination is of utmost requirement in such pandemic and in such responses. When speaking about pandemics, also allow me to go a little bit back to history and to learn from the Spanish flu, which was circulating the world back in 1918. As you can see, very primitive resources. They didn't have social media. They didn't have any form of technology. And this, by the way, was one of their hospitals. I presume it was a church at the time or a school that was transformed into a field hospital. Now, when I did a little bit of research, I found some of their news forecasts at the time. And as you can see, there is a funeral ban, there is a warning against flu, there are dances, classes that are banned, gyms that have been stopped. So very much it's the same efforts that are being done right now. So we're doing the basics plus the technology. Now, a little bit on the side, just to mention that there was an official announcement that Vicks VapoRub is going to treat Spanish influenza. So you can imagine the resources that they had at the time. Why am I mentioning all of this is that the Spanish flu took 3 years until they saw it going away. I hope we don't see 3 years of COVID-19 until we see it going away. We have technology, we have resources, we have intelligence, human being intelligence and artificial intelligence. So inshallah, we do not see the pandemic lasting for 3 years. Many lessons learned from the Spanish flu. Social distancing, again, as basic as it sounds, is still applicable right now. young, healthy adults can also be victims of their own immunity. Unproven drugs, untested drugs and vaccines as well to be careful with, and starting a center for disease surveillance and control early on. Taking you to our Dubai Health Innovation Center and Dubai Health Authority, where we have established in 2019 a 3D printing lab, which came in handy, honestly, in 3D printing face shields right now. Everybody's speaking about PPEs, personal protective equipment, and alhamdulillah, through the lab, we were able to supply DHA with over 1,000 of 3D printed face shields. These are two of our doctors, Dr. Usama and Dr. Khalid, wearing the shield. We were also inspired by a child from Canada to create these mask suspenders, which are great for ladies, especially when they're wearing hijab. It would go around their head and not go around their ears and annoy them. We're also exploring 3D printed nasal swabs right now. Of course, this is half of the story. There is also the test tube that needs to be manufactured. There's also the solution that goes with it as well. And then after that, the PCR machine. We've also been closely working with the higher colleges of technology, monitoring their progress on 3D printing, where they've been working and exploring 3D printed ventilator splitters. We've also, and I think, had a great echoing in the community, where we started the drive-through facilities. This is one of 4 facilities in Dubai. Huge popularity amongst the UAE nationals and the citizens and the residents of the UAE. We've also ramped up our vehicles, delivery medication, from 6 vehicles in January to 30 vehicles. So you can order your medication and it would be delivered to you at home. Started a field hospital, which is currently up to 3,000 bed capacity and more, inshallah, if required. And in terms of identifying the enemy or identifying the genes of the virus, so alhamdulillah, Mohammed University for Medicine and Health Sciences, they have been identifying and ongoingly identifying the types of genes that this virus has. So viruses have the ability to change with time. And we are also documenting the growth of the virus against other nations. Working together with the Department of Health, alhamdulillah, mashallah alayhum, they announced the largest lab outside of China for COVID-19 testing. This is a great achievement for the United Arab Emirates, honestly, where we can now ramp up our testing capacity. Working with our brothers and sisters in NSEMA, Al-Hissan UAE is an app that would be tracking and tracing positive cases and allowing you as a negative person, as a negatively undiagnosed or non-diagnosed, inshallah, with COVID-19, to alert you in terms of coming close to a positive person. And in terms of ramping up our testing facilities in Dubai, the UAE has alone achieved 1.2 million tests so far as to date. 430,000 tests are in Dubai. So that gives you a little bit of a flavor of how much ramping up in terms of testing capacity has done. We have gone from 3,000 tests to 6,000 tests daily, and inshallah more. Alhamdulillah, all of this couldn't have been achieved without His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum, Crown Prince of Dubai's thorough fellowship and mentoring as well and guidance during this COVID-19 situation, working closely with his brother, Sheikh Mansour bin Mohammed bin Rashid Al Maktoum, chairman of the disaster committee in the government of Dubai, and all the director generals. Honestly, I've never seen such wonderful collaboration in this non-wonderful time, unfortunately. However, this collaboration is what's going to get us through this pandemic successfully, inshallah. When you look at Dubai, when you look at the UAE, we have done everything that successful cities, successful countries around the world have done in terms of deployment of technologies. And inshallah, we will have a successful outcome very soon. Thank you so much for allowing me, Khalifa, to present my slides. And I hope that we will continue enlightening you through this panel discussion.
Absolutely. Thank you for your time. And we'll definitely have a bunch of questions that we're going to be asking you, but I think we're going to go through our guest speakers first, going next with Dr. Naseem. Thank you, Dr. for being with us today. We'd love to hear more about what the Dubai Municipality has been working on and how did they utilize the technologies and technical capabilities
Thank you very much, Khalifa, and good afternoon to everyone, dear colleagues, the panelists for today, and also the ones who are going to watching us now and listening to us. I hope that today's session will be beneficial to everyone. As Dr. Mohammed was just explaining, yes, the collaboration among all the entities at this stage is the beautiful thing that happened under these circumstances. I do have also certain slides, if you allow me just to share it with you. I hope it will not take very long time. So the screen is clear for everyone?
Yes.
Good. In Dubai Municipality, as soon as the let's say the issue happened, we always, as you know, all our plans and strategic plans, we make sure that we work on it a little bit earlier than this pandemic happened. At that time, we were considering it as a risk, and it was a risk. And as you know, in the government sector, we all have had, I mean, as per under the umbrella of NCEMA, we have already in the Emirate of Dubai, we have certain risks, and for each entity, there is the owner of the risk, and also there are some support entities. So immediately after we heard about Corona at that time, what we worked, we linked this into our strategic plan in Dubai Municipality, and we started doing things that probably those services were not there. Then we were trying to find out like what is our role will be in such issue in case the situation will be even worse and worse. And we immediately started by looking into our capabilities that we have in terms of the experts, health experts, certain specialities, and also what helped us as well is that in Dubai Municipality, since long back, we have a section which is, working on the registration of certain products like the biocides. So we started working on the cleaning companies that are doing disinfectant, and earlier there was no control over them. So we gathered them all together, and we requested them that you guys need to now work in a way that we will be controlling all the disinfection processes that's happening. The products that we are using, the disinfectants and biocides products, must be all approved. And many of these products, basically, they are the ones that are used business to business. They are all concentrated products, so needs to be used in a safe way where there is a process for that, and it has to be used by professional people as well. So we started that process. Alhamdulillah, maybe the thing that happened with the Dubai Municipality, the agility that we had. So within less than 1 week, we were able with our experts, and it was all in-house, that we could approve all these disinfection companies. We listed them on all our websites. We made it available for everyone. So as soon as there was like positive cases anywhere, we were sending these companies to them. We were also supervising the process of disinfection that was happening. And not only that, we have not stopped, by the way, that one, but we have also started to do the in-house sterilization with our people. And I will come to that very soon. And also we did the approval of the some of the waste management. You may tell me that, okay, the medical waste is always there, and there are certain companies who are doing that, yes. But there were some other waste that they were contaminated, but probably they are not also considered medical waste. So even the belongings of the cases, for example, that needs to be disposed. So these are the things that we also made sure that we gathered all the waste management companies, and we made sure that we also go through evaluation of those companies and approve them and put the list on the website of Dubai Municipality. How we started to do this? Of course, there are various sectors being affected by COVID-19 day by day, even it's more and more, but we made sure that we are aligned with this. There are lots of sectors that the Dubai Municipality is inspecting on those sectors, like, for example, the shopping malls, the educational establishments like the schools, the hotels. Before the lockdown that happened, we had lots of inspection on making sure that these premises are complying with the rules and regulations by NCEMA as well as the higher committee in Dubai. We learned a lot actually from this, especially at the case of Naif. It was a successful story. All of the entities worked on it, and I'm sure that our colleague from Dubai Police has lots of stories, so I probably leave the Naif story to him. But we had 24 hours, 3 shifts, sterilization of Naif, and I may come to a little bit add on it with other photos that I have. So what we did actually, we had lots of, as I said, in Dubai Municipality, it's a routine job that the waste management department, they have lots of trucks, they have vans for cleaning, etc. It's a very routine thing that our irrigation department, they also have certain other equipments. Also we had our, pesticide management team, the same thing, they had lots of other capabilities. So we brought them all together in the beginning of this crisis that happened, and we said you have lots of equipment. So let's, instead of we say that we will buy this and that, no. Let's say that you have these type of equipments, what you can do in-house to make sure that we can start doing the sterilization, especially that we have also another department who are experts in such products. So alhamdulillah, little by little, we start doing that. And maybe you could see from the social media that most of the things that we are doing, especially these pictures, is showing that at the beginning when we started the national program, in late March, for example, there were lots of, like missing equipments, and that is manually being sprayed. Little by little, we made sure, I mean, here even we went even to, not only that, but also when we were covering all the areas in Dubai, that also we made sure that we get into all the areas, all the valleys within the areas, etc. Some of the local people, we were at the gate opening their doors and saying, can you please come and spray even inside the house? We said, okay, no problem. I mean, we usually don't do that, but we didn't want to say no, and we have done this, I mean, for them. The national program is still its own, and we have each day we have 3 shifts actually. The good thing is that our top management is always there. They make sure that they are with our people, the frontliners. Probably the image you can see on the left is our Director General, and also some other Director Generals from other entities also, they contributed and they participated with us. We have certain vehicles that we've done. Maybe I'll show you some of these which we come up with after some time. So every 3 weeks, our people, we have created certain teams. One of the teams is only working on such equipments. So they are working on like what we have in Dubai Municipality. If we can do some changes on it, we have engineers, we have all the people who are experts, then they do it. Otherwise, we may even buy a new device, like the one that is on the right side. We realized that when we are covering all the areas in Dubai, I mean, at the outdoor, we started that program, and we covered all the 226 areas of Dubai. So we covered everywhere. But then we come and we repeat it again. The areas that are having, we call them hot zones. We call them areas that they need like continuous sterilization, like the labor camps, the Naif was one of the cases. There are lots of other areas based on some risk modules that we have. And we realized that we really need now some equipments that are smaller, and it can disinfect the pavements, some areas which the big cars and the big vans cannot get in. So we had certain of these devices already there. It was with our environment department for the beaches. The beaches was locked down, so we said why not to utilize them. So in-house, they've done some of changes, and then successfully we started. And the good thing about it is that it for like around more than 30 minutes, it can cover all the area. So one area, for example, if it's in Al Warga or it's in Mirdif, with 2 of these, we can cover them within 1 hour. The best that happened as well is that we had also certain areas that we really need to reach them without locking down, for example, the road, or areas which are very narrow between the buildings. So even probably we cannot cover them with other devices. So we started with buying the sanitizing drones. Till now we have around 4 of them, and successfully we are using them every day in different areas of Dubai. It's spraying around 5 liters per minute, so it's really fast. And there are lots of specifications for this drone. I mean, our team, the technical people, they've gone through lots of them, and then they have chosen this one, and we are using this in many places in the farm areas and also some other areas. These are our recent equipments that we bought in Dubai Municipality. It's very fast equipments. It's a spraying, it's like a mist turbine it has in it. It's like a fan in it. Throwing distance is really, really high. It reaches a very far distance, not like the manual one which we started with in our program in March. Nowadays, we are all using such equipments. And this is the good about technology, is that our people also work with the company so that they have done lots of changes in it with having such devices for the sterilization program. We also worked with certain companies that we need to have certain gates, disinfection gates, and the one that is here, it's the one that we have used, and we put it in Naif. It's disinfecting the whole car, so there is no need for the person to get outside. It's not for the people, but it's only for the car. So we should also realize here is that the type of the products that are used is totally different. Here we are assuming that the chemicals will only be for the cars and not for the individuals. Many people, many of our CEOs, DGs, volunteers from different places, we make sure that this is like a collaboration actually. So we make sure that we give the chance to everyone. I do remember, this is one of the stories I would like to share, is I do remember when at the beginning of this issue, COVID-19, when happened, many people from other departments in Dubai Municipality, from our customers, they were calling us and saying that we really want to participate, we really want to volunteer. At that time, we didn't have a clear process of shall we get them in or no. As you know, because this is chemicals, concentrated ones, probably there are some risks in it. So we really wanted to work first to have a guideline for them so that we can start. Then we decided, no, we believe this is a chance for everyone. Everyone has the right to combat this COVID and participate in this for the whole nation, let's call it this way. So that's why we have given them the chance to be part of this. Lots of things probably we will be discussing through the discussion, so I will not go through them now. We have done lots of circulars, either but to be used by people in houses or even for the companies, for the premises to comply with, and everything is posted on the website of Dubai Municipality. Thank you.
Thank you so much, Dictora, for your explanation. This was really eye-opening and great to see. I have a bunch of questions which we'll leave, I think, for later on. And for now, we're going to move to our colleague, Dr. Brigadier Khalid Alrazooqi from Dubai Police. If you can tell us, Doctor, a little more about what Dubai Police has been up to.
Assalamu alaikum. First of all, I would like to thank you very much for having me, and would like to thank Dubai Future Academy, and also welcoming everybody in the panelists and everybody around the world who are looking forward to give you an overall of what are the things that Dubai government have been established or provided to the people. As you know that in Dubai Police, we are among of the government entity that were in the frontliners. So we're working very closely with the health authority, Dubai Municipality, and other departments. We are controlling the spreading of the COVID-19 across the city. We will share with you a small presentation about what are the things that we're working with, what are the future plans, and also we're going to share what is the experience that we have. Thanks God that we are living in UAE and we have the strongest infrastructure in case of the technologies and even the bandwidth of network and the interconnectivity. And as you know that the Dubai government even we are the pioneer in providing the system and application where the people can provide all kind of system anywhere around the clock, even from their homes. So during the COVID-19, we have, as you know, we have our customers and even we have our employees. So we have to provide what is the better service to give them the facility without any hiccups during the spreading of the COVID. So we have discovered that it was a huge peak in people of using the online services, especially the mobile service and the internet. And there was a reducing number of people visiting the traditional centers. Because as you know that the people are so afraid of touching any kind of equipment, kiosk machine, etc. That's why we are pushing our team to provide those kind of service 24/7. On the back end, as you know that we do have police officers, they are working day and night. So we have to provide a way that they are connecting to the system remotely in secured way. So we provide all kind of mobile services in secure channel, and they have a fully access through the system. And even we have an employees that working even at homes, accessing to the as they were in the office without any problems. I have a short presentation, if you allow me to share it with you guys. The emerging technologies versus COVID-19. So this is one of the projects that we're working now currently in Dubai. As you know, the most important for the safety and security is to control the people and control the people who are using the roads, using the shopping malls. So we have established a testing currently in a few of the shopping malls. As you know that the government they had announced that the people that can go and visiting the shopping malls and even on the road and in some of the allowed times based on the announcement from the government. So here in the example, those cameras will detect what is the distance between the people. And if there is like a group of people moving together without leaving any distance, it will give us an alarm right away so that we can send the police officers to just let them to stay away, keep a distance between them. The other challenge that we were, as you know, we have a project which is called Uyun. It's one of the strategic projects across the city. We are connecting all the CCTV cameras across the city, even the shopping malls, tourism, tourist attractions areas, roads, you name it. The big challenge is, as you know, we do have a big number of people who are wanted to the government. But the olden days that we detect the people using the facial recognition. Nowadays, everybody is wearing their masks. So how the system gonna detect those? So we are currently working with the company who can detect the person even if he's wearing a mask. And probably I've seen in the news media that the police officers, we provide even them all kind of equipment that they need to monitor the crowd, and even to monitor the temperatures and the heat map of the people who are accessing all those public places, the roads, etc. So this is a special helmet where it has a heat sensor, so it will detect the heat of the persons in front of them, even on distance. And as you know, also probably we're working very closely with the government for the people who have been infected or have been quarantined. We do already have their databases and we do have their information. So we inject all those information to the cameras that we have across the city. So if anybody who had breached the law and he went outside instead of staying in his area, it will give us alarm. So we do have all kind of data that already fetch on all the shopping malls and across the cameras in the city. Also, we have working with among of the universities and the government to provide even better what are the new things, what are new trends. And we have a special team in the crisis management where they are looking for what is the latest technologies across the world. So this is an example of the Khalifa University that's working with, they're monitoring the wastewater. And so it will detect if there's any possibility to track the spread of COVID in general population. And as you mentioned, probably Dr. Mohammed, he mentioned that there's a lot of companies, they are now working to provide the 3D printed face shield. And those kind of shield we already provide to our police officers and anybody who's in the front line. But we're looking forward to also not just using the normal shield, how we can integrate with it like a facial recognition cameras, a heat sensor, all kind of equipment that the police officer can have it with him. And this is one of the examples, a smartwatch that the authorities currently we're using it, especially even in UAE, where it gives the patient who have an active issue with his health with the COVID-19, so we can ensure that they are not violating and self-quarantine. This is also one of the project, it is Uvd Robot. It's been used in disinfect killing the virus or bacteria. So it can be helpful even to use it in the hospital. And also we're currently working with the company in China where to provide the 5G patrol robots. We're going to be available in the shopping malls. So those robots will interact with the people, checking their temperature, checking if they're wanted or not, and also in the same way to keep our people in safe distance among the people. So this is an overall what are the Dubai police are working with, and we always having like a daily meeting. We are monitoring the situation and the spreading of the COVID-19 across the city. And also we do a working now with a lot of companies where they can predict the spreading of the COVID-19 in the city in the future based on the databases that we have. And we do have, probably going to ask us what is the input of those data. We do have a lot of input. As you can see, we do have all the CCTV cameras. We do have an access on the radar across the city. We do have integration with the border control. So all the information that it can help us to predict not just a crime, not an accident, even predict the spreading of the COVID-19. So this is what we have it here in currently in Dubai Police, and we're always looking forward, especially the companies who have any kind of experience or best practice that can help us to control the spreading of the virus. Thank you.
Thank you. Thank you, Brigadier. Thank you. That was very enlightening. If I might ask you, Brigadier, and start with, mashallah, you've had an incredible opportunity to test out many technologies for different aspects of your the services that you give as Dubai Police. What would you say the one that you really felt, had the biggest impact on the way you do work?
Well, thank you, Khalifa, for your excellent question. Actually, once the issue had been spread out in the city, the big challenge is with the companies who are providing us the equipment. Some of the companies had struggling with their manufacture, especially in China, because as you know, they were having a problem with their manufacturers. So a lot of factories had been stopped. So there was a lot of delay of providing those equipment to us as soon as possible. The other part, as you know, nobody had predict or they think that spreading of the COVID-19 will have an impact, especially on the CCTV cameras. The long days, we always just detect the facial, the behavior analysis of the person, and sometimes we check their temperature, but not that closely enough to the people. But nowadays, everybody's wearing their masks. So how we can make the city in safe position, and we can detect also the crimes that have been occurring. The other aspect also, what we have a big challenge, as you know, a lot of people, because they are sitting at their homes, you don't have a lot of people have been lost their jobs. So there's a lot of hacking have been done, a lot of crimes been done, trying to break the banking accounts, trying to foolish the people to send them their credit cards, you name it. So that's why we have a special team who controlling those areas and to stop all kinds of activities. So this is mainly that things, the challenges that we have. One more thing. We do have, as you know, people who are working at homes. Those people, they need a license. And as you know, a lot of the government, they have stopped providing a budget to purchase a new license, new software. And we are controlling the budget to control or to support the medical department and the other sectors. But thank God that the company, they were so cooperative with us. They give us whatever support with us. They give us free license, even a lot of equipment they have provided by themselves. So I really appreciate the good cooperation between us and the private sectors.
That's amazing. Thank you, Brigadier. And you actually answered two questions that people have been asking in the Q&A. One of them, somebody was asking Mr. Rami Malik, saying that the cybersecurity attacks have increased.
Right.
I wasn't personally aware of that. So it's, and you طرقت لهذا. So
yeah. Well, we nowadays we should, as the government, thank God that we have a special department that they are looking to secure the network and the even to provide a better service to the people. But there should be a good awareness, especially with the kids. As you know, Khalifa, a lot of our kids now, they're staying at home. So they spend a lot of their time, what they're doing, playing games. So we have to keep an eye on those kids, see what are the kind of games that they're working with, try to control it. And we're trying very hard with the TRA to close all those bad sites or anything that is affecting our kids and children.
مشكورين على جهودكم دكتور. Brigadier. So ask the same question to my colleagues, Dr. Mohammed or Dr. Naseem. From the technologies that you have seen or the advancement that you have tried to adopt, which ones were you most happy with, proud of, the ones that really increase the efficiency as technology should in your departments?
Khalifa, I think one of the earliest ones to be easily deployed was 3D printing. As you can imagine and know, mashallah alayk, 3D printing can be molded in so many things and so many aspects. But we're still at very experimental stages. However, we were able to deploy many things and work with them immediately. The other thing, of course, and this might be something that we cannot touch and feel, are the data analysis platforms around us. Multiple data analysis platforms have been deployed in the United Arab Emirates to analyze data, to give us future prospects on where we're going. As you can imagine, Dubai and the United Arab Emirates have multiple nationalities living at any one time in them, more than 200 nationalities, and demographically as well different, geographically as well differently located. So as you can imagine, the spikes or the movement of the virus would be in different areas at different time. So the data analysis platforms, I think, around us have really helped us in the containment process of the virus. I would probably vouch it that those two technologies were able to step in immediately.
Amazing. I can't believe that, saying that 5 years ago, who would have thought that 3D printing would be that useful this fast? We thought it's still going to take a while, but here it is. It's good to see.
And I think there is more potential as well to be explored with 3D printing, inshallah soon.
Absolutely. Great. Doctora.
Yes, Khalifa. I do believe the equipment that we have used and the changes that happened over this 2 months, let's say, we internally had some measurements, let's say, to know how exactly the efficiency and the productivity of each worker is changing. And the good thing is that, as I told you, probably we started with the equipment that we already had with some like small changes. I do remember our first time when we started in Redha Street. We covered around 7 kilometers, and it took us around 6 hours to do that. Yes, because of the devices, because of the equipment that we had. But now with these type of devices, the advanced technology that is there, the turbine car that we have, etc., we can cover these things in even less than 20 minutes. So this is how the efficiency now is changing, So I don't think I need to tell more about it. And now even we are working even more than that. So the drone as well is the same thing. For our inspectors to get into and the workers to get into the areas of where the farms are there so that they can start disinfecting such areas. Just imagine right now with the drone, how fast we can do everything. Alhamdulillah, we can say that the efficiency is really increasing.
Dami Wiyach, Dr. Naseem, I think all departments, all our lives have changed drastically, or at least we see so. Some of those changes will stay and some of those changes won't. And I really wanted to dwell a little bit more on that, Doctor. As an example, we've always said we're going to work at home for the longest time. And all of a sudden, because of the situation, now we're working at home. And I think everybody could agree that this is one of the things that will stay even after post-COVID. My general question is, out of the changes that you have implemented right now because of the current situation, which ones do you see will stick with us and stay from a Dubai municipality point of view?
Well, as you said, there are lots of dramatic changes happen. So there are certain areas or sectors, let's say in Dubai municipality, that probably was affected in a way. Some other sectors probably less been affected. Remote working, as an example, it may work with all the admin departments, it will work well as well. Because you are not wasting your time to get into the work, coming back to work, you are spending your time at home. So it's even maybe the efficiency is more. When we come to some other sectors, the field visits must be there. So especially for the inspectors, you know, but even for that part, we changed ourselves. That's why I said in the Dubai Municipality, we have a high rate of agility. We have tried to use our systems that we have. The thing that helped us a lot in Dubai Municipality is that, mashallah, I mean, lots of the services that are provided to the customers, they are all online services, electronic and smart services. And probably the way we were, let's say, using such services, now even this one being changed. Like, for example, we have an application. The application was only giving me product information, nothing else. But due to this, during this 2-month time, we were working a lot. I mean, there was lots of load on IT department. I'm sure that the other entities, they had the same issue. I mean, worldwide probably, that they were doing some little changes in these type of applications, that even we can do some smart inspection through these applications. So instead of I send my inspector to an area to just check for me, for example, the social distancing, if the camera can be on and it's the sensor is somewhere, I have access to that, I can do the monitoring while the inspector is in the office. So these are the things that being changed, and probably these are lessons by the way, we learned a lot. And I'm sure that after COVID, we will not going to go back to the traditional way. For sure, many things will be changed, and probably one of them is this one, for sure. But if I may add, it's not only for Dubai Municipality, but if I can even talk on behalf of the even private sector. We have lots of customers from private sector, maybe, and these 2-3 months, we could realize that there are lots of products, the biocides, the disinfectants, in the market. The number will increase. I mean, 40% of all the products that was registered in Dubai Municipality since years and years, 40% of them being registered only during the last 3 months. Many of the companies, the manufacturing companies, they even changed their line of factory. They change it from maybe either in line, they work in line, or they change demand is really high on this. So it changed many things. It changed many sectors, private sector, Dubai Municipality departments, how they worked on it, and also some other entities. I hope I answered your question anyway.
Absolutely, you did. Thank you so much, Dr. I'm not sure, one of my colleagues talked about Al-Hassan app. Who was it?
Dr. Mohammed.
Dr. we have a question for you, I guess, and it has to do with the app. Somebody is really intrigued, wanting to know, how does the app really work? I'm not sure if you have the answer, but you know, some people are asking that question.
Right. So many countries, once patients have been identified as positive, they would like to know their location to prevent patients who are negative from getting into close contact with them. There are multiple successful implementations of such an app. In the UAE, we have one app that has been approved by the National Committee in SEMA, where we have been advocating all as health authorities in the United Arab Emirates to use this single app. Now, we have also gone beyond that, where there are now, should a patient be positive and they do not download this app and do not comply with this app, there are now fines that have been announced in the recent announcement. The technology is very, very simple. It is Bluetooth enabled, it is GPS enabled. Yes, it consumes part of the data. However, the benefit is on the patient themselves and the surrounding people that are close families and people that they would be interacting with. It's a very, very simple technology. However, the coordinated effort and the unified effort is what is important in such an approach.
Great. Same question to you, Doctor, as I was talking to Dr. Naseem.
Yes.
Yeah, after Dr. Naseem told us about the municipality and how really changed the way they do business and work, I'm sure because you are really at the front line as the Dubai Healthcare Authority, how did you really see, what changes do you think would stick after COVID?
Wallahi, for a sigh of relief, I know that AI cannot replace real doctors.
Okay.
I think that this was a debate for a long time. AI will be replacing real doctors and real surgeons and so on. However, time has shown us during COVID-19 that doctors are going to be still needed to be out in the field, I think deployed in a fast way. And Izam al Khair, the frontliners, whether from doctors or technicians, Dubai Police, Dubai Municipality, Roads and Transport Authority, I cannot tell you how important it was for them to be doing what they do at the front line. So allow me on behalf of Dubai Future Academy to send them through this platform high salutes on what they have been doing. Now, on that same note, I've also seen AI working with us rather than against us. We have been deploying multiple artificial intelligence tools, whether it's from a chatbot or design elements in 3D printing or data analysis as well, where artificial intelligence has helped us in buying time, gaining time. As you know, and alhamdulillah, rahmat rabbil alameen, and the wave came to us maybe in March or in late February. So we had some time, and that time was accelerated with the use of artificial intelligence, where we've seen it work صراحة wonders in a positive way. Now, in terms of working from home policies, Dubai Health Authority, as it has out in the field team members, we also have administrators who have been in compliance of working from their home. I myself have 3 teams who are reporting to me. All 3 teams have been working from home, except for yours truly, where I had to do a little bit of movement around the field. However, their safety was of my concern. I was very pleased to see His Excellency, the Secretary General of the Executive Council, Saadat Ali Abdallah al-Basti, to announce that there should be 100% compliance with administrative jobs wherever possible to work from home. So this is a very eloquent example where all government staff and their families' health was of utmost importance to us. In terms of going to life after COVID-19, I don't think life after COVID-19 will be similar to life before COVID-19. But allow me to also dwell on a point where life during COVID-19 has to be transformational. We have to adapt fast. We have to also be creative. It's as if the world has gone through a reset button, and we all have to be now running fast at a coordinated effort, fast pace, where to think of the next and to think of how do we adapt to life after COVID-19. I think this is going to be a journey. It's going to be changing. Even myself, when I look at the data from February, March, April, May, and now June, there is a huge change in the way we think in our methodology as well. I'm sure this change would continue with us for a while. However, agility, as Dr. Naseem mentioned, fast adoption, working together in a coordinated effort are going to be of utmost importance to us as a government.
Amazing. Thank you, Dr. And to that, Brigadier Khalid, then I'll ask you this question, and really we're going towards the end of our session. The silver lining, Brigadier, you see a lot of demographics in the city. You deal with a lot of situations, let's say COVID-related and not. Have you seen any silver lining because of the current situation? Things that have changed, behaviors that have changed that you think are going towards the pattern?
Well, Khalifa, first of all, as you know, that Dubai, we do have more than 200 nationalities from different countries living in our city. And we really would like to thank them very much for their cooperative with us as a government. There was huge among the sending messages to the people in different languages to know the situation, what are the things that they should do. Life has been changed a lot, and even as Dr. Mohammed and Dr. Naseem mentioned that we are on a stage that our life has been going to be changed. If you allow me, I have one slide to share it with you guys to explain the things that we should consider about it. All right. So, as you know that, especially in my department, an IT department or an AI department, I have around 200 nationalities, 200 employees working with me. 90% of them, they're working at home right now. So what we need to activate the online meeting system between the employees. So we need to provide the best system across the government so that we can interact with even the private sector, government, employees. And as you know, that a lot of companies nowadays, they have provided those kind of online meeting. Yeah. And but we have to think about it, which is going to be secured as a government to have a much more features. We do need to automate an AI process for all kind of services that we provide to the people. So we are re-engineering all kind of service that we provide to the people so that we can predict their requirement before asking. And also to qualify the employee to work remotely at 100% to ensure their continuity of service during the crisis. And also we should think to have a private cloud among the government. So we can store all kinds of information, integrated the data between the government, even the private sectors, and also to provide a strategic partnership with all kind of technical network equipment, service systems across the companies. So we have to work very closely. And as you can see from this situation, we work as one team, all the government working together to fight against the spreading of the virus. Not just us, even the world, the whole world are working all as one team. So we have to exchange the information, exchange the experience among others. So yeah, so this is about it, and we have to think something for the future-wise, not for ourselves, even for our children, our kids in the future.
Absolutely. I think to that note, Brigadier, we come close to the end of our session. I'm just going quickly through the questions, seeing that we've answered the majority of them. Maybe there is one, and really I'll leave the floor to either Dr. Mohammed or Brigadier Khalid to maybe pick on this topic. People sit in their homes now, and sometimes that becomes very heavy on them. And I just wanted to know, are we addressing the mental aspect of society now? I think that could be our last question for today.
Go ahead, Doctor.
Yes, mental health has been on our agenda for a while. Pre-COVID-19, we have a strategy for mental health in Government of Dubai, headed by Dubai Health Authority, approved by the Executive Council. It takes into consideration the health of a child, a mother, a pregnant mother, and the elderly, and the entire society in Dubai. Now, when COVID-19 came, we saw some disruption to that strategy. Mental health now is at risk. As you can imagine, we have a term in healthcare called post-traumatic stress disorder. This is really for war veterans who have survived wars. However, they still remember elements of war, and they have this impact on their psychological well-being. I hope we will not reach to that level. Now, that is an extreme and worrying scenario. However, we have to be ready for it. Yes, alhamdulillah, we can say that we are conquering this virus. However, we have to be vigilant, not only for this virus's second wave, but as well for other consequences such as mental health. And alhamdulillah, today, We have within the Command Control Center established by His Highness Sheikh Hamdan Mohammad Ras Al Maktoum at the beginning of the COVID-19 pandemic, a track that tackles specifically mental health. So initiatives are going to come. I know time is not on our hands right now with the session to go and dwell into these initiatives. However, stay tuned for more initiatives to be announced from the CCC.
Jazakumullah alf khair. Thank you very much for your time. Thank you for enlightening myself and everybody here with us on the panel about the great efforts that the government is doing. We honestly are very proud of you and very happy that we are in these circumstances with this leadership. And I thank you very much. I thank my colleagues for giving me the opportunity to moderate this really great session. And مبروك عليكم الشهر، مبروك العشر الأواخر، ما شبقى عن العيد. Thank you. Thank you very much.
Khalifa.
Mashkoor Khalifa. Thank you very much.
Thank you so much, Khalifa and the team, and also our colleagues and whoever attended the session. Thank you so much.